Bev, I think we're prepping.
Perfect. It says.
Bev, we are live. Dr. Beverly, we are live. I want to welcome everybody to another segment of Destination Health Podcast. Today, Dr. Beverly Yates and I are going to do a little bit of a mini cast today, and we're going to have some fun. We're going to be talking about diabetes and heart disease, which is still the #1 killer in the world today. And Dr. Beverly, want to welcome you to the program. How are you today, Dr. Bev?
I am feeling great, really great, Dr. Dan. It's wonderful to be able to talk to you about such a rich topic because it's such a common experience people have. And we're just here to try to help educate people and motivate and inspire, because the better care you take of yourself, the better off your life's going to be.
And you and I have that shared interest. You're into diabetes. I'm into cardiovascular disease, and they're really first cousins, or they're not brothers and sisters, brothers, twins, and so forth. So tell me, how did you get into diabetic work? What was that aha moment that you had?
Hey, what a great question. You know, when I started out my career, my focus was on cardiovascular work, stress, sleep, gut health, and hormonal disruptions that can go along with heart disease, problems with stress, sleep, and gut health, right? But then I started to see about 20 years ago, 15 years ago in my practice, that more and more people were coming in who had type 2 diabetes, they had pre-diabetes, they had polycystic ovarian syndrome and insulin resistance, they had metabolic syndrome, all these things that are so blood sugar centric. And I was, one, alarmed because I saw this big increase, and two, inspired to change and improve some of the things I was doing as a doctor, because I realized these things are so lifestyle sensitive. It's both the challenge and the opportunity. It's great news because you could do something about your lifestyle. But listen, just because the things that they need to do are specific, it's not always easy to make those changes. That's just real.
You know, it is something. I have a ton of questions just by that first open comment that you made. And there's so many people that have problems with diabetes and heart disease, and it's lifestyle dependent.
Yes.
This is important because that means that we can help individuals out that have these types of conditions. Okay, so give us a couple of lifestyle, what you've seen clinically. What are some lifestyle changes that people can make in order to help themselves out in this condition?
Yeah, there's just a lot of basic things that, and somewhat not so basic things that we just aren't typically taught. We didn't learn it in school, and when we go to see various health professionals, conventional professionals or others, we might not hear this, right? There's these 5 factors, 5 steps that make that difference. Nutrition, I think everybody could agree, is probably the bullseye of the target. What you're eating matters a lot for your health. Another one is your sleep habits. If your sleep's a mess, it's going to be real hard to have good blood sugar control. And if your sleep's a mess, it's hard to have heart health, right? These things, like you said, they're like cousins or brothers and sisters. They are closely aligned, these topics, right? There's a reason why there's that crossover. Other things that are a factor are stress. I think everybody knows that stress is a big deal when it comes to heart health, and stress is a big deal for diabetes. But people with diabetes are often not taught all of the things that can be stressful that will hijack their blood sugar. And so if it's type 2 diabetes, pre-diabetes, if it's type 1 diabetes, type 1.5, stress is not your friend. Good stress or bad stress. Good stress is happy and uplifting, but can still tax your blood sugar in an interesting way. But bad stress, unwelcome stress, is really like the bully in the room. I say it grabs you by your genetic collar and slams you up against the wall of whatever your vulnerabilities, your weaknesses are. The tricky thing.
I love that analogy.
I love that analogy,
the bully. Dr. Beth. Yeah, I love that. And I don't mean to interrupt you, but we do have a bunch of people that are watching right now because we're live. And if you have any questions, anybody, please put them in the comments section, and we will be more than happy to answer them. We actually have Andrea Mars that's watching us. She is a former student of mine at the University of Bridgeport. And so she is a budding nutritionist, functional nutritionist. So Andrea, if you have any questions, ask away. But know that I can go back and change grades, I think 10 years after you graduate. So you have to get them right.
Dr. Dan, that sounds stressful. That sounds stressful.
Well, you know, was the class stressful, Andrea? I think that one was fun, and Think Patho was really hard. So anyway, Dr. Bev, I'm sorry for interrupting. Go ahead.
Okay. Hi, Andrea. That's funny, Dr. Dan. That's a real life example, friends, of stress, right? Right on the spot, So this brings me to our next point about stress. People have different responses. What one person considers stressful, another person might think is not a problem or joyful, right? Like a friend of mine was talking about the responses that she notices between her martial arts instructor and her friend who's a psychologist. The psychologist can talk about difficult feelings and emotions and things like that and is not stressed by that. The martial arts instructor, on the other hand, if you ask that person to go a little deeper on their emotional world, they are stressed about it. The other one,
Right.
the psychologist doesn't like that physical confrontation. The martial artist is all about it, and it's fine. We are so different. So you can't do like this one size fits all approach to stress, but we need to know what is a trigger for us and have a plan so that we can keep it from destroying our health, because it is a thief in the night. It really is.
Stress is it's just so bad when you don't know how to deal with it. You have to be resilient. You have to be able to, sit with it and figure it out, because without doing that, it becomes a very difficult problem. I love that you mentioned diet, because I can sit there and you and I live in the same universe. People come in and they just got poor diets, right? They're eating fast food, Bev. They're drinking iced tea because it's made from the best stuff on earth, right? And you hear that, and so you might as well drink it because it's made from the best stuff on earth. Right?
Water.
And
the best stuff on earth is water.
Water. Best stuff on earth is water. Hydration, eating an anti-inflammatory diet, and there's many different types of diets that are out there. I like to mix and match diets. What about you, Dr. Bev? When it comes to recommending diets?
I found over the years it's important to mix and match, because even twins or triplets don't all eat the same thing, and more importantly, they don't respond the same way to foods, even though they share the same DNA. So because the gut's microbiome is that individual, it's just like our fingerprints, or an eye scan, it's that individual. It's why you use that for identification. How your gut is responding to your food matters. And some people will have blood sugar spikes unexpectedly from otherwise healthy foods. What if you're a person who has an unusual blood sugar reaction, either a big spike up or a crash down to something that most people think of as healthy, like say cauliflower or blueberries or quinoa? If that's you, and you think you're eating a healthy diet and you aren't testing, you're just guessing. That's why we say test, don't guess. If you don't know what your blood sugar is doing when you're eating your meals, if you're having snacks, your beverages you drink, whatever you're doing, you don't know where you're at with the whole situation. You have to solve that.
I think that's a perfect segue into our next topic, because if you're not testing, you're guessing.
Right.
That is the most important aspect of this. And if you are not looking at the foods that you should be eating, foods that you should be avoiding, that becomes a problem, because food intolerances can lead to a leaky gut, for example, and then it can lead to, metabolic stuff like you and I deal with. We deal with metabolic dysregulation. And what happens is that you get that type 2 diabetes and you get that cardiovascular disease. Right. And so food intolerances and eating is very important. Talk about food intolerances and why is this important in all of this?
Yeah. So food intolerances, I always think of it as it can have a mask. If you think about the theater symbol, it shows the face and it shows a smiling face and a sad face. I feel like food intolerances can go both ways, because there are people who have leaky gut, they've got GI compromise, they've got all sorts of things going on in their intestines, they've got gas and bloating, they're uncomfortable, etc. And in that world of discomfort, there's sometimes a pearl of what's going on with their blood sugar. And sometimes what people experience as those uncomfortable symptoms are actually blood sugar reactions. And if you realize that you're having a blood sugar reaction and you get that solved, often the GI things can resolve. Think of it like this. If your thumb is sore, would you keep hammering it if you had a sore thumb? No. So you'd want to figure out what's the hammer that's causing the blood sugar reactions or the food intolerances, et cetera. Is it you're eating too much of something? Is it too frequently? Should you not have it at all? Do you need to do some gut repair work? Because your gut's going to help determine some of your blood sugar for sure.
Absolutely. And that's a great analogy, right? It's kind of like, the definition of insanity. You're going to keep hitting your finger, and you really don't need to hit your finger. And that's where you and I come in, because what I'm seeing coming out of what we're coming out of over the last 2 to 3 years, right? Can't mention any, right?
I know.
But we're coming out of that, Dr. Bill. Right. Dr. Beverly, what we're noticing, and I'm sure you know, because you and I have spoken about this at conferences, is that there's such an uptick in this metabolic dysregulation
Yes.
because people were eating poorly and they were stressed, right? Do you find that in your office?
Absolutely. So part of what I'm seeing right now is a big spike, not surprisingly, in people who have inflammation. So some of my patients where it's appropriate will test for inflammatory markers, and I'm seeing people's numbers just rise. So I know that background stew of stress, poor sleep from worry, right? Nutritional things, people understandably either want more of comfort foods, the foods they're familiar with, or maybe they're going to eat fast food, they're eating highly processed, already prepared food we already know it's not nutrient dense. What a perfect storm. It's a setup for a problem.
You know that we're live because my dogs are barking in the background. I have no idea why. So this is extremely important because I found that my patients, CDC indicated about 25 pounds, 30 pounds on the average that people have gained weight. I'm finding 50 to 60 pounds, okay, in my office, where people are gaining or have gained that much weight coming out of what we're coming out of. And that's just crazy as far as I'm concerned. It's kind of like as a society, and you and I discuss this all the time, kind of as a society, we just kind of went to our lowest common denominator instead of coming out of this in a better way, right? And so we decided to eat all of the improper foods. We weren't exercising. We weren't getting our sunshine. You know, our sleep was disrupted, and we just weren't doing anything. Talk about sleep. Sleep is so important when it comes to metabolic regulation.
The need for rest. Sleep is our opportunity every day. I tell my patients, it's like, this is when you invite yourself to hit the reset button, start over.
Right.
And if you aren't sleeping well, so many things in your body aren't healing. Sleep is when everything gets to heal, regenerate, and reset. It's when your digestive system, and this is important, friends, your digestive system gets to rest because you aren't eating. Big deal to have that fasting window when you're asleep because you're not eating anything, you're not drinking anything, right? So that's when all the repair mechanisms happen, just to put the physical side. And I would like to invite people to consider on the spiritual and mental side that we are also hitting that reset button. This is when your soul gets a chance to go, whoo, we got through that day. All right, let's get ready for the next day. And if you're
I love that.
Yeah. And if your sleep's not happening, Dan, right? Heart's racing and thumping in your chest. Your brain's whirring. It's got like hamsters in a wheel cage, multiple hamsters. It's not good.
Insulin's all over the place. Cortisol is all over the place. That's when you get that sugar dysregulation going on.
Yeah.
I have my Aura ring. I'm tracking my sleep. There you go. Right. And our mastermind was like, all right, we're all big on this at Mindshare.
It helps
in getting this.
This Aura ring really helps with those insights. Yeah.
Right. I mean, listen, I was talking with Dr. Apigian not too long ago, and it was like, do you have your Aura ring? And I said no. And it was like, okay, it's on its way. Here's the link, and I got $50 off. And so if anybody wants to get $50 off, contact us and we can help you get $50 off the Aura ring. And it's really a great device where you can track your sleep. Last night was good. The night before was really good. I was in the 90s, so I was happy. It was restful. It was restful, restorative sleep.
That's important.
Not every night is right. Not every night is like that, but you need to make sure that you start working on these lifestyle changes and make these positive lifestyle changes in order to get better. And that's interesting because you and I, we've decided to team up. Right? We've decided to team up, and we want to help individuals out because we know that people are not eating the best. We know that people are not resting the best. We know that people probably have some leaky gut issues. We know that people are having difficulties. They're not hydrating as you are right now. And we want to help individuals out. And we're going to have next week a masterclass. Okay. It's going to be next Tuesday, this upcoming Tuesday, which is April 4th, I believe, right? April 4th?
April 4th.
April 4th, 7:00 Eastern Standard, 4:00 Pacific, and anything in between. All right. And we're going to have the link. I'm going to drop it in the comments section, and you can sign up. You can sign up and you can listen to Dr. Beverly and I discuss some actionable tips to start helping you out. We're going to specifically, when it comes to diabetes. We're going to talk about the Yates protocol, which I'm very excited about. Give us a little bit about what the Yates protocol consists of.
Yeah, so the Yates protocol is my program that I've created over these years of working with my patients and clients to meet people where they're at, to be practical and encouraging, and to give people real advice about how to get a hold of their blood sugar so they can be healthy. I make sure that what people are eating are their familiar foods prepared in a healthy way. Let me say that again. Your familiar foods and spices and flavor profile in a healthy way. I'm not asking you to eat stuff that's completely unknown to you or that you cannot stand, because no one is going to be successful with that approach.
And that's important, because when patients come in, right, they're thinking that they're going to eat bland food and they're going to eat just a little bit of it, right?
You're going to eat a little grass.
Right, they're gonna have a little lemongrass, and there's gonna be a little lemon that you're gonna put on it, and then there's gonna be a little piece of beef or something like that. No. You eat nutritious and delicious foods when we're doing this. So your diet is very important. What else is important on the Yates protocol?
So what else is important, right? This is my overall theme of no suffering, is making sure that you understand what's going on with your sleep, so that we can be sure we've got that covered. Because to not talk about sleep and make sure that you have good, healthy sleep habits in place is a mistake, because all other healing will be compromised if you aren't getting your rest. And sometimes people make some basic mistakes, or sometimes some more not obvious mistakes around sleep, right? Stress. We've talked about stress as the bully. Absolutely. It's the thief in the night for help. Making sure that you have a situation either where you know how to handle your stress and bounce back, or help you strategize around that. And sometimes, friends, just so you know, additional lab testing might be indicated, whether it's for your cortisol response or other things, to determine if your stress response is normal or not. Because if it isn't normal, it will interfere with your heart health, your blood sugar health, your moods, your weight, and a whole bunch of other things. It really will.
It's very important to get cortisol testing, and we do that. And I know that you do it. I do it in my office. It is extremely important, because that stress response, if you're not rocking and rolling with it and able to deal with it, you're going to gain some weight, you're going to get diabetes, you're going to get heart disease, and that's just not good. Right. I'm excited about the Yates protocol, Dr. Yates.
Thank you. My patients wanted me to name it that way. And, it's not the whole 1950s advice of eat less and move more. In today's world, it's so much more complex. There's plenty of people eating less and moving more, and they've still got type 2 diabetes. So clearly we need to have more nuance and more specificity. We'll talk about exercise a little bit, and we will talk about meal timing. Meal timing can be a game changer for people, right?
Right. And all my patients know that are listening right now, we call it meal timing. We have to do our nutritional timing. Right. Because if we don't, and we have to look specifically at what each individual's lifestyle is, so that we can meal prep and time those meals so that it works for them, so that they're fueling their body appropriately throughout the day, to make sure that their biochemistry and their physiology is regulated. Because in the end, people, that's what we're doing, is we're regulating their biochemistry and physiology, and we're doing it through diet, exercise, sleep, hydration, and so forth and so on. Very important, because your protocol is very much like my protocol. We take a look at lifestyle, and we take a look at what we're doing. And I always said it, I always ask patients, do you smoke? And some of them say yes. And I say, does anybody smoke anymore? But they usually do, right? And that we're going to get you, we want you to stop these negative lifestyle habits and put together some positive lifestyle habits, so that we can help you out. And that's
absolutely
that's exactly what we're going to do next Wednesday, 7 p.m. Eastern Standard Time. Tuesday, 7 p.m. Eastern Standard Time, April 4th. And it's going to be exciting. I'm looking forward to us helping out a lot of people and serving humankind to help them out. Okay, Dr. Bev, we're almost done here. Tell me, any last words? I'm giving you the last words.
Take action now. Come join us. Don't kick this can down the road, or you risk something you really don't want happening. Come join us now.
Join up. Take a look in the comments section. We're going to put that in there today. The link to give, the link for you to join. This is going to be motivational, inspirational, educational. We're going to give you some actionable steps. We're going to tell you what's going on, how to help yourself, so that you can start moving forward. Okay. Yeah. Perhaps you need to lose some weight. Perhaps you need to bring down your HbA1c. Perhaps you need to bring down some of those biomarkers for your lipid panels. We need to give you this information, and then you can start working towards. Listen, when at the end, when this is all done, all my patients at the end of a month, Dr. Bev, they say, "What's next?" Because I haven't felt this good in 20 years, right? Am I right or am I wrong?
Exactly. You're absolutely right. You're absolutely right.
Right? They've lost.
Let's turn the clock back.
Pounds appropriately. They've done this. They've done. They've tried everything. This is the best way to do it. So yeah. April 4th, 7 p.m. Eastern Standard, 4 p.m. Pacific. Okay. Look for the link, and we look to see. We want you to be there. Okay, and we want to make sure that we help that we can give you some actionable steps.
You bet,
Dr. Beverly. It's been great talking with you as usual.
Same.
All right, Dr. Beverly in San Francisco, Silicon Valley. That comes from our New Orleans retreat. So everybody, thank you very much for listening. Please share this with family, friends, neighbors, coworkers. We'll see you next Tuesday. Dr. Beverly, thank you very much for your time.
You're welcome.
Take care, everybody.